So our campaign is about the disparities in primary care in California, and that is the issue that we're looking at today. This is an issue that is occurring nationwide, but our campaign is focusing specifically on California. The state of California is in need of around 4,700 extra primary care physicians by 2025, and it is important that these efforts are made to increase the number of primary care physicians so that there isn't a burden on the healthcare system and patients' health isn't impacted. So the diagram to the right shows the amount of primary care physicians per area in California. All the areas that are in white are areas that are facing a shortage or insufficient amount of primary care physicians. And it's very clear that the majority of California is in this shortage or insufficient range. Our goals with this project are to educate, inform, and raise awareness about the shortage of primary care physicians in California and its effect on the general community. By launching this campaign, we are able to work to educate and inspire more young adults and teens to choose and or consider careers as primary care physicians.
The reason why we selected this issue of which is disparities in primary care is because the region that we are in is Downton County, and is one of the many that face an extreme lack in primary care physicians. And if there isn't an increase in the amount of primary care physicians in California, then it's most likely possible that the mortality rates, waiting times for appointments, and the amount of patients with any condition, chronic condition may increase due to lack of primary care physicians.
So some projects that we conducted to spread awareness throughout our community include like posting flyers and infographics around local areas in our city, such as like cafes, libraries, learning centers. We also presented our project at multiple science fairs to get one-on-one interactions with people around our community, including young adults and teenagers. And then we also held interviews, for example, with Dr. Jessica Cha. She's a primary care physician. And we also uploaded a blog about that on our website, our experience talking to her. And then we also spoke with Dr. Ramya Naranjan. She's a primary pediatric dentist, and she also worked towards opening a clinic in an underserved area, lacking clinics. So we uploaded that video on our YouTube channel. And then we also presented our project at our school's health expo to talk to many medical professionals who visited and also students. And then we also, this is a work in progress, but we will be uploading an article at some of our local newspapers, including the Mountain House Matters and Tracy Press.
Below is our website, which you can visit to learn more information, and to contact us is our email, disparitiesandprimarycare@gmail.com. And below are some of our social medias, including our Instagram, Twitter, and YouTube.
Thank you.
Guys, that was really great. It's really inspiring to see, high school students doing the kind of work that we are paid to do, and you guys are doing this with your busy time, and we really appreciate it because, as you mentioned, one of the solutions to the primary care shortage in the United States is to get students like you interested in becoming primary care physicians from a really young age. I have two questions for you. One, where did you get the data for your maps and or your map that you showed at the very beginning? And then the second, can you share a little bit, maybe there aren't any, but of any programs you guys are hearing about in your area to try to get young students, whether it's elementary school students, middle school students, high school students, into medical school and eventually into choosing primary care careers?
So the course we used for our graph or the chart was Let's Get Healthy California.gov. I can send you a link of that if you'd like.
Okay, great.
Okay. Then, so some programs that we haven't really encountered too many actually, which are working to solve this issue, which is another reason why we wanted to take a stance and start something.
That's great. On the phone or on the computer screen, you have two people who work for the American Academy of Family Physicians, Karen Mitchell and Ashley Bentley, who are very interested in growing the pipeline of primary care. I don't know if any of them can speak to any programs for high school students or are aware of any programs. Ashley, Karen, are you all aware of any programs that our guests could get involved in?
I'm waiting just a moment because if Ashley can get on, I'll let her speak. And Ashley, if you want to come on, feel free to do so, but I will go ahead and answer. And that is one of the things that we have as an opportunity is that through the local HOSA chapters, there is an opportunity to participate in the family medicine competition. And I'm curious if the three of you are involved in that and if that was part of the what you're planning on with this project. And so because we have a family medicine competition that is now part of HOSA. The other thing that we have going on is a connection with our local chapters. And so California may be able to help connect you. If you aren't connected already with the California Academy of Family Physicians, then that we have an opportunity for you to be connected that way with the state chapter, really to be able to connect with medical students and practicing physicians, and particularly that can help to fulfill some of the competition requirements if you choose to participate. It looks like Ashley she just gave a link for our AAFP resources that we have available to HOSA students. And so this is very exciting. I am thrilled to be seeing the work that you're doing and the outreach. That is exactly what we hope the programming through HOSA and the relationship that we have between HOSA and the AFP. This is exactly what we were hoping for. So I'm so thrilled that you have stepped up and that you're exploring family medicine and talking about the health disparities in this way.
Thank you, Karen.
Thank you so much.
And our event is actually community awareness for HOSA.
Would one of you explain so the Graham Center is not as aware as Karen and Ashley are of what HOSA is, and can one of you on the call explain that to us? We're the researchers.
Do you want let students go for it.
Yes, yeah. Sorry, I meant one of the students. Yes.
So HOSA is basically a club for all the students who are in our school in the biomedical pathway to participate in a variety of different events. And all those events have different opportunities. They have rounds for qualifying and opportunities to go to state and compete internationally as well. And a lot of schools many schools in California, not including schools from other states as well, participate in HOSA yearly. And so it's a really big competition and experience for everyone to join in.
Yeah, and also, so our campaign is also not only just affiliated with HOSA, it's just like something we're doing just in general too. We're just competing this campaign in HOSA as well.
Like, we would like to continue this like till college if we think it's like a good idea and it will look great and it has a great cause.
I just want to add on that HOSA is basically like something for any as Rashika or Suhana said about the biomedical pathway for students to take, and also to enhance like provision on healthcare to all people to promote their like career opportunities, and it's also like all hands-on activities and healthcare skills for us to have an idea what it's going to be like when we choose it as our career.
This is really fascinating. This is Allison, and this is a really fascinating topic, and we certainly appreciate it so much because it's near and dear to our hearts. I have two questions for you. One's really easy. What does HOSA stand for? And then the second is, when you presented this at like the science fairs and other places, what have people said? What has been your feedback?
I'll answer your first one. HOSA stands for Health Occupation Students of America. And in the science fair, we basically made a science board and we presented it. So there were a lot of questions since the information was limited. But most of them told us that we did a good job, and most of us gave a very constructive feedback of what we could add more. Maybe we could make it more interactive for the kids so they can understand as well, and include like more diagrams so it's easier to read.
A lot of people asked us about like where our statistics were from. They asked us like information on why this was an issue in the first place, to which we replied that many aspiring medical professionals are not even aware of this shortage and aren't aware of how great of a field primary care is, and that why they should pursue it. So we definitely explained that to a lot of people, and we definitely a lot of teenagers and young adults asked us the benefits on why they should pursue primary care. So we definitely helped spread awareness to that to a lot of people in our community.
I think adding on to that, most to all of the district science fairs that we presented at were for middle schoolers, so that when they came into high school, they would have some sort of idea of where we were coming from with this and what we were connected with. So that was just to encourage them so that they know earlier before they go through the entire cycle.
Very neat.
Yeah, I just want to add on that we were kind of targeting when we went to the science fairs for mostly like 8th graders because that was their last year in middle school and they would be freshmen in high school next year. And so, as Rashika said, they have an idea what HOSA and the biomedical pathway is.
I had only one comment. Impressive work. So amazing to see high school students doing this. I just wanted to know like whether they can present at NAPRAG as a poster or so.
Yeah, there might be some great opportunities for you all. You know, there are physicians in the room, as you heard, primary care physicians and on the board. And you know, Karen and Ashley are from our kind of our education division, and the rest of us are from the research division. So if you all are interested in growing your research, there's lots of resources we can give you to help with that. One could be conferences that you might be able to present at, and we can help make those connections for you. They're big international scientific conferences, but it's nothing you need to be. They're very friendly audiences, and you guys have already presented this so many times. We can help you grow it. And then the second thing I'll say is that I know you're very far away in California, but if you do want to make a visit to DC, we would be open to having you here in person, and we can talk about ways that, you know, we can help you kind of grow in your research in person. You guys, for high schoolers, man, this is such great work, and you know, we could help you take it to the next level if you're interested.
Yes, that would be awesome. Thank you so much.
We'd love to get in touch with you about all these opportunities. Thank you.
We really appreciate it.
Absolutely.
And the next big conference is in California.
Yes.
It's in San Francisco.
Oh, that's
it's right up the road from
right.
you all in November.
Yeah, the big conference that we're talking about. Are you guys seniors though?
We're freshmen.
Oh my
Oh my
gosh. This is crazy. You guys are so talented. All right. Yeah, so the next big conference, yeah, Allison is right, will be in San Francisco. So, not too far, not as far away as Washington DC. So I think Anam has your email and we can communicate via email to see what we can do to get you there.
Yeah, that would be great.
Yeah, for sure. Thank you so much. Yeah, I'll just put the slides in the chat right now.
Okay. Awesome. Anything else?
All right, if there are no other questions, thank you again so much for presenting. I'm going to stop the recording now.
Okay. Yeah, thank you so much. We really appreciate meeting with you guys once again. It was a great experience and we really appreciate your time.
Absolutely. You're welcome to stay for the rest of the meeting.